Good afternoon, Ruchita ma'am. Ruchita ma'am. Hello. Ruchita ma'am, are you there? Fatima ma'am. Hello. Ma'am, shall we start the class? Anybody, please?
Yes, sir.
Can you please post in the group, your WhatsApp group, that class is started? Can you please help? Okay, it is already 7 minutes. So shall we start, students? Please at least one person respond, please.
Okay.
Okay, right. We will start it. Today we are going to discuss about the anxiety disorders. Block 3 is having 3 disorders: anxiety, personality, and mood disorders. Generally, these are very compared to other disorders. They are very prevalent in society, in all cultures, all over the world. Depression, generally mood disorders are more comparatively, and 18% around will be there in population will suffer from one day or other day in their life. But fear and anxiety are since childhood we can observe them. But if you see the anxiety and fear, these two are interrelated. Vaguely discussing, fear is about a particular object, number one. There is a fixed object, and reaction also that they think that there is a threat. Second concept, second element. Third element is they know that what type of reaction is going to happen, what type of loss going to happen, whether it is loss to property or loss to the health, loss to the assets. All are defined in fear. So object-wise, there are different nomenclature is there. Object-wise is called claustrophobia, agoraphobia, like that, depending on the object for which we fear. Please remember that here it is a definite. But in case of anxiety, what I'm telling to for remembering purpose, not going in detail, anxiety is vague. Suppose some friend's family is coming to the house, a family visit, then there will be a little bit anxiety, anticipatory anxiety, saying that what happens. Here, what harm or threat you feel is, they may think that you are not efficient in keeping the house clean or preparing food clean, what type of comments they will make. You don't know what comment, this is vague. That is anxiety. So because generally it is asked in the interviews, this question is very important because more number of patients will be suffering from this. So now going deeper analysis. Why we study anxiety more is compared to other diseases, anxiety causes more physical symptoms. It causes hypertension, that is BP, sugar, heart problems, diabetes. So they are prone to asthma, pains, circulatory problems, respiratory problems, muscular problems. Because there is a concept of fight and flight, whether to face it or not to face it or escape it. For escaping it or facing it, you need more energy. For more energy, body will be supplying more blood to external parts, where you have to run or fight or flight, everything muscular action is required. That's why muscles will be always attentive stage in anxiety. Similarly, sympathetic nervous system will be excited. So your eyes become dilated or constricted. Anybody tell? This black spot in the eye that become expanded or constricted, become small or big?
Big, sir.
Excellent. It becomes big. The reason is more light should go inside so that you can observe what it is going to happen in the surroundings. What type of threat is going to come from outside. Similarly, your circulation will be increased. Sugar will be released from the liver because you need more energy. At that point, anxious movement, at that 5-10 minutes, there will be helter-skelter in the body. How everything gets excited, strenuous. So you have to face it mentally, cognitively, that is cognitively, emotionally, and behaviorally, you have to face. All three components will be there. Please remember this. For this, lot of energy is required. That energy is released by liver, that in form of sugar, glycogen, and this sugar should be circulated to the blood. That's why blood BP gets increased. So number of times our heart should pump also increases so that more blood supply will be there to the cells and more energy will be supplied through sugar. This is the mechanism of coping internally. That is what happens. Once that fear tapers down, parasympathetic system makes the body relaxed. Everything goes reverse. So this is what, because the circulation, respiration, and the skeletal system functioning gets impacted, all other parts and systems gets impacted due to this. That's why more number of physical sufferings will be there with anxiety-related diseases. This is basic concept about anxiety. Now, going analytical part, anxiety disorders are divided into 5 groups. One is generalized anxiety, simple phobia, panic disorder, obsessive compulsive disorder, and post-traumatic stress disorder. This looks PTSD, please remember, this looks very new or something, but most of the people will be having it. So yesterday there was a client to our clinic saying that his neighbor died due to heart attack because he is a drunkard. So he got a fear that he will die. So what type of anxiety it is, we'll see. Okay. So all these things are about future. They think that danger is going to come in future, within 1 minute, 2 minutes, 3 minutes like that. So not about the past. This is about the future. Now let us see what is this each of these diseases. In earlier days, this group of diseases, along with anxiety, these 5 disorders, we have stress and conversion, that what we call ponakam in Telugu, like behavior, hysterical behavior, that whatever happened, that, and not having real depersonalization, derealization. That means they won't recognize what the world is. World is a myth life. And depersonalization means they think that they are floating in the air and something, that concept will be coming. These are all, this group is called as, in earlier days, neurosis. If you see different personality theories, you get extroverts, introvert, neurosis, psychosis. Especially Penn theory give it Ising. Ising theory period he elaborately discussed. Also Kettle also discussed all this. This neurosis persons know that what they are doing, how they are feeling, how they are reacting. Please remember the difference between neurosis and psychosis is neurotic people know what all these disorders are there for them. They are suffering from them. They are reacting like this. So this is in their consciousness. Psychosis means they don't know what they are doing. They're unrealistic. They will be living in unrealistic world. They don't know what is reality. They will be imagining illusions, delusions related to the perception will be there, misperceptions will be there, wrong perceptions will be there. Also, fixed beliefs are there. Somebody is going to kill me. That is fixed belief is there. Such beliefs also contribute. This is called psychosis. Psychosis person don't know that, client don't know that they are having this disease or these symptoms. Okay. This is difference between neurosis and the psychosis. Most of the personality disorder scales in psychology, we identify them through certain questionnaire. One thing the psychology student should know is how to diagnose this. Are there any laboratories or blood tests for this? Can anybody tell? How? No, pardon?
No, sir. No blood tests.
Good. How we detect? A person comes to our clinic, how we detect?
Through interrogations.
Through interaction?
I mean.
Good.
Yes, sir.
One point. Second point? How to, that is called understanding the client. So he is having so-and-so symptoms, so-and-so symptom. But pakka, according to the, we will discuss about criteria. Criteria is given ICD-10 or in the DSM-4 or 5, whatever system you are following. Latest one is DSM-5. So their criteria is given. You cannot go on questioning the person whether this criteria is meeting or not. This is what a psychiatrist does. Observe it, ask a few questions. That criteria, that particular problem should be there for 6 months. It should get repeated twice or thrice in a year. Some duration and frequency will be there and symptoms will be there. They straight away start giving medicines. But as a psychologist, like if we are practicing, what we should do? Can anybody tell how we diagnose? Very important question, that's why I'm asking. We have scales. Scales means questionnaire. This is nothing but psychopathology. Our lab is nothing but scales. Our blood tests are nothing but these assessment scales. They are called assessment scales. Because it is all concepts are in the brain and the mind, internal processes. We cannot actually see the processes, but result is behavior. That is what we observe. We can measure also. But in terms of processes, very difficult. Only biological approach discusses more. What psychological approach, what we do is we develop scales depending on this criteria. Different issues like palpitation, we have seen a heartbeat, we will ask how you feel tensed, what is the reaction, when you feel, what triggers, how frequently, all these each item we will ask, how is your sweating in the palm and feet. That is anxious symptom, right? So similarly, how is your blood circulation? How is your respiration at that point of time? Are you getting sleep or not? How are your energy levels at that time? Do you feel legs and muscles contracted? Something like that. We can form questionnaire. If you have broad idea about this and the criteria, you can prepare your own questionnaire and start practicing. Once I admit to 10 people, 20 people, and then if it is giving good results and confirming to what you are thinking, then it will become a validity is there and reliability. That means consistent results it is there. Consistently it is identifying persons having anxiety. Then it will become a standard state. You will get patented and you will market it, earn money. This is what happens in our psychology field. Okay, is it clear? Anybody? Please tell. Okay, anybody?
Yes, sir.
Good. So now this is the basics. Now we go for elaborate discussion about all these anxiety disorders. First one is generalized anxiety. You are feeling anxiety for particular appointment or maybe particular examination or meeting particular person, appointment or regular meeting persons also. For each and every aspect of activity, if you feel anxious, that it will become generalized. General means encompassing all activities, most of the activities. If it is pertaining to particular activity is different, and if it is pertaining to more or less every activity, if you feel anxious, palpitation increases, heartbeat increases, and temperature increases, and your BP increases, and perspiration increases, you will become confused. So you want to run away from the situation. So that these things happens in most of these situations. That's why it is called a generalized anxiety disorder. What is the basic thing is here? Again, there is fear. What is fear? Fear is nothing but emotion that gives a threat feeling in the future that is going to happen. So I have to fight or flight. Similarly, there is in generalized anxiety, these people, this earlier days, if you read the DSM manuals, it is mentioned as free-floating anxiety. That means in your mind, there is this anxiety is floating always, more or less permanent feature. That's why it is called generalized anxiety. Formally, it is known as free-floating anxiety. Many literatures, you see this. When you're reading about medicines also, you see this one. So chronic excessive worry, what is the definition of this one? Chronic excessive worry, what is the duration? How many symptoms should be there? That is criteria will be given in ICD-10 or DSM. So what is given in DSM, we will see. So according to fifth latest manual, there should be 6 symptoms out of, there should be 3 symptoms out of 6 symptoms. Please remember that one. There should be at least that should be there in the last 6 months. This is a criteria. Duration is given, number of symptoms are given. This is how the criteria is given. What is this? When anxiety comes, you will become restless. All we know it. You will feel weakness or fatigue, and then concentration will not be there. There will be irritability, muscular tension, body aches, sleep disturbances. These are all major 6 symptoms. Other symptoms are also there. Yet given only 6. In this, there should be 3 for a period of 6 months. Okay. This what it causes? It causes disturbance in our functioning. What are the areas of functioning? Always remember areas of functioning psychology. Whenever we say functioning in home, functioning in society, functioning in office, functioning as a student in the school, all cultural activities or religious activities. They are all areas of functioning. Please remember, dysfunctional means you become dysfunctional in these areas. In psychology, this is very important term, dysfunctional, maladaptive behavior also dysfunction. In these areas, you reflect them. We have to observe when a person or child, husband, anybody there, if you want to know their anxiety levels, just how they are functioning, how is their functioning in different areas that you have to identify, personal areas. Okay. Lastly, we have to rule out that these 3 out of the 6 problems are not due to other psychological disease or due to other mental disorders or drug-induced. Sometimes when you take some medicines, drug also induces similar symptoms temporarily. That we have to rule out. So it is more equally distributed among the male and female. Some diseases are we find more in female, some diseases more in male. For example, antisocial more in the male, bipolar, borderline personality more in the female. Similar, but anxiety-related disorder, generalized anxiety disorder is equally among male and female. This point is very good point to remember. So what are the causes? We have already discussed earlier. When you write about the causes, one is biological, cognitive, behavioral, humanistic, existential, social relationship, or interrelationship. These approaches just you apply, and each one has its own meaning. So when biological, he says that it is genetically, there is proof that it runs in the family genetically. Chemistry-wise, which hormone causes anxiety? It is GABA. Gamma aminobutyric acid is major thing. Generally, when it is less, then we get anxiety. That's why GABA-related increasing medicines are given. So to reduce the anxiety, anxiolytics they are called. Nowadays, some psychiatrists are giving serotonin, which is related to depression. That medicine is also found to be acting on anxiety, but some people it is increasing anxiety. What we have seen is norepinephrine. We are all know epinephrine is released from the adrenaline, which stays above our cap, above our kidney. This gets message from hypothalamus and pituitary, and these hormones are released. Norepinephrine, epinephrine are regulators of stress. They act on the parasympathetic nervous system, which excites all functions in the body. Okay. Whenever there is excitement, we go for reducing them in the blood circulation. Our other therapy, another cause is psychological causes. In this psychoanalysis says, what causes anxiety? It is the imbalance of ego, failure to control demands of superego. Yesterday we discussed that. Causes anxiety. Okay, superego is work on morality bound. Superego is morality bound. So it asks not to do like that. So ego says you do, we do. Ego says you do more. So this conflict, from this conflict, you get anxiety. This is what Freud says. Then to check the anxiety, which is worrisome, what our ego does is they try to push these unfavorable experiences into subconscious or unconscious minds, ultimately into unconscious mind. If that also fails, anxiety becomes more in the body, in our mind. So ultimately, those physical symptoms become permanent. So you will get more diseases. So nowadays, more concentration is always put on reducing anxiety and stress. These two considered to be most vulnerable experiences for major disorders like even cancer, incurable diseases. Humanistic people say if there is obstructions to development of personality, fully functioning person, self-actualization, where your ideal self and the real self meet. If there are obstacles, then it will cause anxiety. But major cause, what he says, is already there in the children, where parents are highly disciplined. Yesterday, we have seen develop parenting styles. One of the parents, authoritarian. There are two, authoritative, authoritarian things. Authoritarian is good. Authoritarian is not good. They are more dominant persons. So we have to reduce them. The parenting style should be changed. That is very important. Then cognitive behavioral social stresses we have discussed. All stresses causes traumatic events. So cognitive behavioral school is also just 1 minute. Excuse me. I will stop that call. Sir, we will continue. So cognitive behavioral therapy, we have seen in the childhood, there will be cognitive biases like memory bias, and then it creates maladaptive schema. All bad experiences put together, it creates a schema in the mind, different components of experiences put together, saying that persons are not good, male is not good, female is not good, childhood is very bad, future is not good. This type of negative feelings and beliefs will be embedded there. From there comes cognitive distortions. I already discussed I am statement, and then rules and assumptions. From there, automatic negative thoughts when you fail, really fail. What is automatic negative thought? They are called as ANTs, automatic negative thoughts, ANT. They are very, there are 13 to 14 ANTs are there saying that I should feel always guilty for not a capital. So a person always suffer from that guilt complex. This also causes. So this is another anxious element. So what is the treatment? Cognitive behavioral therapy. What we do? Cognitive restructuring. Major component is in cognitive restructuring. Time is not there. Otherwise, we should have done one experiment here. What we say here is we ask them to collect childhood experiences. What is his maladaptive schema? We will collect. What is his in his memory? What are the biases that we try to collect from his history? And then we give a questionnaire. I told you our lab, we have a pathological experiments, assessments. We will give questionnaire saying I am statement, I am statements, also I must statements. Also another one is if I fail or if I cannot achieve, if I cannot face, then what happens? That all these questions they will fill, and from that we will decide what are his distorted beliefs, feelings, and we try to question them. Socrates Socrates questioning is there, and Aristotle's questioning is there. We will asking them. Question leads to another question. Question leads to answer. Answer leads to another question. We will be asking him what are the, suppose he says that particular person is harassing me through so-and-so activities. Then we will ask him to provide proof. How many times he did? He did in the last 10 years, he did only once. Then is there truth in that? Is there reality? That type of questions will be there. This is how we change the belief system, and behavioral experimentation will be there. We ask him to meet the person with whom he is fearing or not feeling well. So that person goes and meet that person slowly after our clearing of these doubts or our doubts. We ask him to meet him. That is called behavioral experimentation. Practice. One is theory, and the second one is practice. That is, this practice is behavior. That questioning and clearing the fears is cognitive element. So cognition plus behavior mixed, that will become cognitive behavioral therapy. For each and every personality disorders or any disorders, we can give cognitive behavioral therapy. Out of all different therapies, CBT is the best therapy for all aspects, most of the aspects. So this is how we give the treatment. Psychoanalytical, I already told you about how the couch table will be there, free talking will be there, free association. And then some unconscious mind, all elements become integrated into present day consciousness of that person, so that some of the conflicts get resolved. Next one is panic disorder. In anxiety, he thinks that it is the threat that is going to come. But here it is more than that. There is an impending doom that is going to more or less annihilate him or annihilate the society or people or his own assets. This is the feeling here. Please remember those words while writing. Impending doom. That is enough. All other symptoms, what are there? Breathing, circulation, muscle, chest pain, respiratory problems, and vertigo-like things, lightheadedness. This comes, trembling of hands, with other symptoms automatically come. I already told about depersonalization, derealization, which are part of neurosis. Depersonalization, feeling out-of-body experience, is floating in the air or dancing with damsels. So derealization, feeling that world is not a real thing, something different is there. So this is how generally these type of when that episode comes, it will be there for 10 minutes with a high intensity. Please remember this 10 minutes duration. During that period, what do you do? During that period, we tell him to don't try to educate him. What we have to do at that time, anxious, this panic moment. It is very severe, intense. Panic moment, you have to tell him about relaxation technique immediately. So breathing technique or progressive muscle relaxation technique, you can teach him. And diversion of mind, another 2-3 elements will temporarily dissuade. But please remember, don't give chronic treatment for chronic symptoms at that point of time. This is alarming, right? Acute, this is acuteness. Chronicness treatment is different acuteness. First, you have to relax him in this moment. Please remember this. So panic, we have already, whatever we have discussed earlier, all are there here also. But here there should be 4 out of nearly 13 symptoms. Trembling, palpitation, shortness of breath, choking, chest pain, vomiting sensation, and dizziness, fainting sensation, uneasiness. So many books in book, they are all listed, you can know them. But 2 things what are not there, one thing that is not there in the anxiety is here, there will be persistent worry. More the panic attacks, more persistent worry will be there, and significant abnormal changes in the behavior. Any one should be there in this. Apart from those 4 symptoms, these 2, one should be there. This is criteria for the panic disorder. So etiology is more or less same, but neurobiological aspect play, neurotransmitters play important role. In that, norepinephrine, which is stress hormone, it plays important role. Where it got message of production, takes place in norepinephrine production takes place in sympathetic nervous system, also in the adrenal. So in brain, what is the locality that controls is locus coeruleus. Coeruleus. Important word for examination purpose. So that will be important stimulating point, one of the causes for this panic, alarming state. Then classical conditioning, when children in the childhood, parents say that some devil is coming, or police is coming, or somebody will catch you, take you away from us. Some type of fears we will be incorporating with the conditional. That also grows in the mind. That is one cause. Cognitive perspective, we already seen there is maladaptive schema in the childhood that leads to is negative interpretation of events that leads to the panic. So what are the treatment? Anxiety related GABA controlling medicine, that is anxiolytics, will be given. Apart from that, we give him relaxation techniques. I already discussed about that. Also awareness that what are his problems. How he gets awareness? Every episode, you should maintain a diary that is called journaling. You should write what is trigger by seeing what you got that one, even what is that event, description of event, what are his mental thoughts at that time, and what are the accompanying physical symptoms, what he did, he went for X-ray, he went for ECG, something like that. He takes, and then ultimately he comes to us and we will give cognitive behavioral therapy, whether it REBT or CBT. Okay. Then CBT have discussed. Also educate him about self-monitoring, how to manage at the particular point of the. Also give training, behavioral experimentation also we can give for that person. Always tell him that these are all about future. It may happen, may not happen. First education point is whatever they think is not a reality. That is not in the present moment. It happens in the future. He thinks that it may happen in the future. May happen, may not happen. That is the first education we have to give. Then phobias are, here the word, first one is threat. Second one is vague consequences in the anxiety. In panic, it is impending doom. That word is important. In phobia, it is persistent and disproportionate fear. These two words are important. Okay, it leads to specific phobia about particular object or a social anxiety disorder in the society, meeting people, meeting persons, anxiety. That will be there in this. So what is the criteria for that? It is about specific object or situation. Suppose you are flying. In the flight, you will get anxiety. So generally, people travel sickness, we say. Travel sickness happens due to fear. That fear might be there that it is going to fall or meet accident, something like that. In children, how they are exhibited is by expressing, they express by crying or freezing or clinging to the parents, or sometimes they play tantrums. Okay, so most in phobia, the reaction immediately starts. That objects immediately provokes, and we try to avoid it. Fight and flight, we try to avoid the phobic event or place. Some people won't go to higher place, heights, generally mountains, like things, they won't go because they fear. Some people won't travel in train because of that fear. So this feeling of danger is out of proportion. It should be there for 6 months, last for 6 months. That condition should be met, criteria should be met. Social anxiety is also unrealistic, and it is also depending on the situations in the society. What is that? We always remember two things. One is we judge badly, we judge unrealistically, we judge things negatively. This causes this social anxiety disorder. So not only known persons, also it happens in unknown persons. You will get this anxiety. Social anxiety. So this is generally when you perform stage shows are there, when you try to give a speech or stage show singing or performing a dance, then you think that others are going to evaluate badly. They may evaluate, may not evaluate. They may appreciate also. These points I won't take into consideration. Unrealistically, unjustifying, they will adopt improper justification of bad comment. But there is opposite also. That's why we always educate in these people about alternative explanation. You are thinking that they will comment you bad. But what is the probability? What are the chances of commenting positively? How many times you got negative comments? This type of evaluation we put forward to reduce their anxiety. So here also it is people that this type of phobias are common in the childhood. It is in the evolutionary process automatically if people get it, but many people overcome due to positive elements in their family, positive family structure, positive elements in the brought up or parenting style. That many of us overcome it. But some people will continue those phobias for people, phobias for objects, dogs, animals, like that, darkness, police, such items are targets. So it is part of survival. And the psychoanalysis, already we discussed about ego, what unconscious things in it. So treatment also, exposure therapy is related to behavioral therapy, not cognitive behavior. It is behavioral therapy. We prepare a hierarchy of events which causes in this type of phobias. To which event or each occasion you get more fear. Like that hierarchy, we try to expose him to the minimum fear. This is in the last rung, whatever minimum is there. From there, we start exposing slowly, higher intense phobia item, object is exposed. But before that, most of us, what we do is we give him imaginatory therapy, where we ask him to imagine that particular height is there and some other person is climbing it. And he is not falling, he is successfully climbing down. You also can do it like that. So first we show him pictures, then we show him films, then we show him the visualization techniques like guided meditation, and then slowly exposing physically. I accompany the child to that situation. Slowly, I withdraw as a counselor, and the child will stay with that object that fear gets reduced. This is called mastery therapy. Okay. This then comes obsessive compulsive disorders. OCD, the terms you always remember, there is O means obsession of thoughts. They are intruding. If you can't resist them, you can't control them. They will be coming. What type of the thoughts are coming, we'll discuss. Second one is that the thought demands some action. There is an anxiety from this thought. To reduce that anxiety, you will be doing some action. That action must be done. That is called compulsion. Action is compulsion. Thought is intrusion. These two words you have to write. So why a person does like that is nothing but to reduce anxiety as a defense mechanism. Okay, what are different obsessive compulsive actions we do? Counting of numbers, arrangement of things, and cleaning, and checking lock is properly done or not. Locking is properly done or not. This type of repetitive actions will be there in one's life. They won't admit it because others may judge him badly. Evaluative element is there. That's why they won't judge. They won't come forward to reveal it. We have to observe them. Family members should observe and bring it to the notice of counselor. So why they do this action? This compulsion is made by the thought itself. So if you prevent the thought, you can stop the recurrence. Another theory says, you prevent the action, thought gets automatically resisted and it diminishes. Now people are going for stopping the action first. But if you stop the action, what happens? Thought process gets increased initially. We have to educate the parents and client that your thought process of unneedliness or fear of infections or fear of death, all these unhealthy, intrusive thoughts, compulsive thoughts, obsessive thoughts are to be countered by stopping the action, subsequent action. So for first 5 days or 10 days, it will be havoc. So we give family counseling to these persons. This same thing, the criteria here is recurrent and persisting thoughts. Not only thoughts, it could be images or urges. It could be sexual or non-sexual. It could be objects or events or animals or people. So that thought leads to action. So anxiety, it gives anxiety. To reduce anxiety, we do the actions. So performance is compulsion. So repetitive behaviors and what are the mental acts? Mental acts, as I told, these images are, number one is praying. I have got one of the clients saying every time she goes for praying, sitting in a corner of the room and goes on praying for hours together. Whenever there is some anxiety, whenever that thought comes. So this is a mental activity. Then comes the counting. They won't count loudly. They will be moving the fingers. 1, 2, 3, 4, 5. The counting with the fingers. Not physically, you can't see physically counting the objects, but it is counting done through mouth, lip movement, or through hands. So repeated the words in the mouth. These are mental acts. Most of the people think that this is mostly OCD is only physical act. So now comes how etiology comes. Oh no, generally we don't know why OCD happens. It is most of the people, it is due to genetics. It runs through families. Also earlier we discussed neurobiology, also influences. Some epigenetics, which are influence of environment, also influences. So treatment more for OCD is ERP. ERP means exposure and response therapy. What is there, what we have done in the phobias, same thing we will repeat here. Also, he has a thought that if infection, touching particular thing, infect is hands and body get infected, and he has to bath it, wash the hands. That's why every time he hands on. What is the thought here? It's a maladaptive belief is cognitive distortion is there. That the hand, if it is not washed, he will get infection. That infection he will spread to family members. Entire family will die out of infection. This thought process will be changed with cognitive behavior therapy because it is irrational thought. Then post-traumatic disorder, earlier I told about a client coming by seeing that his neighbor dying. So here also, he become a nightmare for him. And in the mind frequently, whenever he sees or listens or somebody talking about death or about heart attack, then this person starts getting that fear, stress, immediate stress, fear, anxiety builds up. So it will be recurring. Second one is avoidance of, then they try to avoid those, going to those places. Then as I told you, there is arousal, sympathetic nervous system exerting so many, respiratory, circulatory, muscular, skeletal system will get impacted. Same thing he discussed here, PSTD, post-traumatic stress disorder, direct exposure. It will, there are, he had given H8 criteria he had given. One is he may see directly, or he may direct exposure, or he may be witnessing the trauma along with others. Second one is somebody telling that particular person died after this so-and-so. And another one is indirect exposure of details of drama. During the counseling period, if the counselor is weak, he gets affected by listening to those events. Then how it is reflected in the sleep, nightmares, fearful dreams, and he will get flashbacks and emotional stress and physical stress. Then what he avoids is avoids the thoughts and feelings and reminding those thoughts. They try to do it, but it is, unless resilience is there, positive attitude is there in their brought up and childhood and the neighborhood, in the environment, he cannot resist them. He become more vulnerable. That's why he try to do it. But when he cannot do it, that one, he has to approach a counselor. Then negative thoughts will be there, he will not get any enjoyment in the activities earlier he is having it. And he can, memory starts failing, and more negative thoughts will be coming about the world and himself. These negative thoughts will be coming. This is third feature. But during the arousal period, when he gets that experience of trauma, re-experience of trauma, then irritability, destructive behavior, lack of oxygen, respiratory problem, and startling, and difficulty in concentration and sleeping. These are different aspects which the person experiences. And then what is the duration? Duration is 1 month. Not 6 months here, 1 month only. Also, we have to rule out that it is not due to other diseases and other medicines and other causes. Functional impairment is not due to other causes, but due to this OCD only, the post-traumatic disorder only. Okay, this is about the stress disorder. We have to identify stresses and what are biologically any, if medication is required, then if a psychiatrist is there, he will identify what causes this post-traumatic stress disorder, related hormone related pertaining to that particular problem, medicine will be given. Then it is, as we know, this is mental process, we will give cognitive behavioral therapy here. Questioning and what we discussed earlier, process for cognitive behavioral therapy. This is about the anxiety disorders. Any doubts here? Okay, we have another 10 minutes. We will shortly discuss for tomorrow's class about personality disorder. What is personality? Please remember personality disorder. Both are, there are different assessment, different scales, examination to identify them. What is personality? Personality is dynamic organization of psychological, mental process and physical process that emanate our behavior. Okay. So personality, during that process, we have specific behavior. Every person is having his own specific behavior, which is peculiar. This behavior is generally enduring, and we can predict and also measure sometimes. This is about personality. What are personality disorders? A personality is not well organized and causing dysfunction, deviation from social norms, and personality that is dysfunctional in different areas are called as personality disorders. These are classified into 3 groups. First group, always remember, if you want to write it. I will tell you acronym to remember these 10 personality disorders. PA-SS, PASS. PA-SS, PASS. Second, and another A-B-HI-NA. PASS, ABHI-NA. Third group, A-O-DR. PASS, ABHI-NA, AO-DR. This is acronym which can, you are telling the dearest person not to come closer to you. In this we have PA is, what is PA? In this group, there are 3 groups. First group is what we are telling is PA. PA means paranoid, doubtful characters. Second one is schizoid. Schizoid means avoidance will be there, social avoidance will be there. What is the cause? We will discuss. Another S is schizotypal. Schizotypal also keeps away, but they are nearer to the schizophrenic patients. If schizotypal is not cured, it becomes schizophrenic in the future. This is PASS. ABHI-NA, second group, second cluster. A for antisocial, B for borderline, HI histrionic, NA is narcissistic. ABHI-NA, PASS, ABHI-NA. AO-DR. A here now avoidance. O for obsessive compulsive personality disorder. D is for dependent personality. You just remember this word, this acronym for memory, for memorization. It will be very easy for you. Is it okay? Did you write it? Anybody wants repetition? Okay. Now, this personality disorders are there around 10% of the population presently. Most prevalent is OCP, obsessive compulsive personality disorder. In anxiety, we discussed about OCD, obsessive compulsive disorder. Here, obsessive compulsive personality disorder, difference what is that, we'll see later. So, most prevalent is OCPD, narcissistic in male 7%, borderline female also 7%. In India, there are about 3% of people are having this overall spectrum. So first, borderline histrionic and dependent are more prevalent in female, and rest are more in men. These borderline personality disorders accompanied with or correlated or associated with other psychological disorders also. Most drug addicts and then substance abuse people and alcoholic abuse. These are all related to one another. Also abuse, drug abuse also, like medicinal drug abuse, addictive medicinal addiction also causes this one. Now, we will try to do this first group, very easy. First group has 3 elements. Please remember, all these three PASS, paranoid, schizotypal, and schizoid are having 3 elements. That one is social awkwardness, that means odd behavior. Second one is social withdrawal. Fourth one is eccentric behavior. Okay, these 3 you have to write when you are writing about this first cluster. But mentioning them will get more marks for you. But generally, it is very important unit. Okay, they are inconsistent with the social norms. That behavior, whatever we see, or thought process, whatever they tell, is unusual and inconsistent with the social norms. That is deviation from social norms. What is paranoid is very simple to remember. Paranoid is nothing but doubtful. Husband doubts wife, wife doubts husband. Not only wife and husband, neighbors, every person whom they come across, they will be doubting. They assume, there is assumption is there. Also wrong interpretation is there. It is unrealistic and unjustified. These words you have to write. Misinterpretation, false assumptions, and unjustified doubts are key words in this. So that's why they think that people will try to deceive them, exploit them. That's why they keep away. Social withdrawal is keyword. No? How paranoid persons will keep away. This is the cause. What are major symptoms are, as we already discussed, suspicion is there, distrust is there. Also, they will be suspecting. Suppose at the house, newly 2 brothers are there. One brother got married and this mother is paranoid. Then she start doubting that second son is having affair with first. Similarly, some friends or relatives come home, they doubt that they take away something from their home. This type of behaviors they will be exhibiting. And that person who is having this paranoid, some neighbors are there in the neighbor house, relatives come to their house. Then these people think that those people came, those 2, the relative and the neighbor collude and they try to harm her, take away some property or gold. That type of thoughts is continuously they will be having. Please remember these, all the spectrum of 10 disorders, they have their seeding in childhood. They become, after 18 years, they become manifested. Some cases, it becomes manifested in age of 50. Don't think that is a new and sudden onset. So now this having thinking that they will deceive and they will attack or they will manipulate, they will exploit or deceive. These concepts are common in these people. And that's why they won't believe anybody. They develop hostility. When they develop hostility with family members and relatives and neighbors, they get isolated. So social withdrawal happens like that in these people. So we'll complete this and close it. Just a few minutes. Then what are the, this process is not sudden, we have discussed. And what are the causes? They are there in the biological contribution also there. But it is limited evidence is there regarding the genetic aspects. And culturally, some people have it. So mostly the prisoners and people who come from other countries, refugees, taking shelter in other countries, and people, antisocial people, and hearing impairment people. Old age also people get due to hormonal changes. So this is, but in the childhood, we can observe them. Please remember, as parents, we can observe some features in the children, then we have to educate them, giving cognitive awareness. Treatment for this is cognitive behavioral therapy only. We have already discussed. Also educating that isolation is not good. As long as you live in society, you need positive relationships. We have to educate them about the relationship and social activities, and thinking, also questioning, rational questioning, that how many times people deceived you, how many times people attacked you, how many times your property is stolen. This type of questions. If nothing happened, why you fear that? This type of questioning will educate them. Okay, now we will stop it. We will continue tomorrow. Okay. Any doubts? Any doubts till now?
No, sir.
Okay, thank you very much.
Thank you, sir.
Thank you. Welcome.